Caldoun, our Chief Medical Executive, and Craig Carmody, the Superintendent of Meridian Public Schools. As the national vaccine rollout keeps chugging along, we are making steady progress toward our goal of equitably vaccinating 70% of Michiganders ages 16 and up. To date, we have administered 1,942,759 vaccines. Michigan is 9th nationwide for total vaccines administered, and our case count and positivity rates remain among the lowest in the country. Our target remains equitably distributing at least 50,000 shots per day, a metric that we have met for 13 days, including 5 days where we were above 60,000 doses. As of today, several groups of frontline workers, including pre-K through 12, educators, and all Michigan residents over 65 are eligible for the vaccine. Millions of families have been touched by this deadly virus, and we will not rest as we work to get second shots in arms while prioritizing our frontline workers, educators, our veterans, and seniors. Over the weekend, the American death toll hit a grim milestone, surpassing 500,000 Americans. It's 500,000 Americans. It's staggering. It matches the loss of life felt during World War II, the Korean War, and Vietnam combined. Hundreds of times more than the number of stars that we can see in the night sky. Think about this, it's enough to fill the big house in Ann Arbor 5 times over. We've lost over 15,000 Michiganders to COVID-19. If we took 1 minute of silence to recognize each life, it would last 10 days, 16 hours, and 2 minutes of silence. So while the vaccine rollout continues and our lives slowly start returning to normal, it is important that we remember what the cost has been and why it's so important we stay vigilant. Here in Michigan, we will continue to work toward meeting our vaccination goals so that we can protect public health, put people back to work, and get our kids back in school. To meet this metric, we must pass the Michigan COVID Recovery Plan. It spends over $5 billion that has already been appropriated to us in a bipartisan bill that was signed by Donald Trump in December. If the legislature does not act, the $2 per hour wage increase for direct care workers will expire this Sunday. And the plan includes $1.7 billion that goes directly to our schools to help them meet the March 1st in-person learning target, to provide additional support to students, and rapidly ramp up testing. The urgency to pass this plan couldn't be higher. We need 3 to 4 million Binax antigen tests every single month to effectively open schools, to track the variants, and to protect students, staff, and teachers. These tests have been an essential tool to re-engaging our economy and getting us back to normal sooner. We have been forced to delay critical lab enhancements just to keep up with Michigan's testing needs. And if the legislature does not act to pass the recovery plan, Michigan will not be able to keep up with the testing demand from students, student athletes, school staff, and teachers for much longer. We need the legislature to do their job and pass the COVID recovery plan so we can keep purchasing these critical antigen tests. We can't spend money to test people and ramp up vaccinations if we don't have it. But think about all the people who wanted to re-engage school sports. They're counting on us to have these tests so that they can continue doing that and stay safe in doing it. All the people who want to re-engage in-person learning. This is crucial to that. Anyone who wants to visit a loved one in a nursing home, this is an important piece of doing that. I introduced the plan nearly a month ago, and I look forward to passing it so that we can support small businesses, put people back to work, and send our kids back to school. Now that last piece is what we're going to focus on today, in this press conference. It's a topic on all of our minds. 7 weeks ago, I stood here and set a goal of having every public school in Michigan provide an in-learning option by March 1. As of today, 83% of school districts are currently back in person, according to the report from our research partners at EPIC, and 97% of school districts will be back in person in one way or another by March 1. So today, I want to explain why having in-person learning is so crucial, and I want to walk through fact-based, data-driven approach that we are taking to ensure schools can reopen for in-person learning by March 1 without compromising the health of our students, staff, teachers, and everyone in our school ecosystem. Why is in-person learning so critical? Well, from my personal experience as a parent, watching my own daughter and her classmates miss out on so much, I can see every day why it's critical. Schools are cornerstones of healthy, vibrant communities. In addition to academic achievement, a school environment provides social and emotional skills that are foundational to our kids' development. These qualitative aspects of childhood are difficult to develop without peer-to-peer interaction. For young children especially, face-to-face learning is critical. And while some students and families have been successful with distance learning, far too many have struggled. A significant loss of classroom hours and instruction time have long-term consequences on a child's long-term development. And right now, tens of thousands of vulnerable children in Michigan risk falling through the cracks and staying stuck behind unless we made concerted efforts to catch them up. In addition to the clear academic consequences, there have been disheartening impacts on our children's mental and physical health since their lives were upended in March. According to data from the CDC, anxiety and depression rates are up, and child immunization rates are down. Schools are often the first place that children receive a vision and hearing screening to quickly address some of the most basic barriers to learning, both services that have been on pause during remote learning. Staff who are especially trained to detect and address child abuse and neglect are unable to do so remotely. So there are consequences on that front as well. Without schools, our economy is hamstrung. Working families have been spread too thin over the past year, often taking on the roles of parent, teacher, and employee all at the same time. It's just not sustainable. Parents rely on schools as places for their children to learn while they're working inside and outside their homes. Some parents have had to make the difficult decision to step away from the workforce and care for their children and support virtual learning. Overwhelming data shows that this burden is felt and is falling predominantly on women who are stepping out of the workforce because of the lack of in-person school and child care options. The massive job losses amidst the ongoing economic downturn have forced 2.4 million women, disproportionately women of color, out of the workforce since last February. To help working families, we're also taking steps to reopen child care and expand child care programs. Since last April, we've provided grants to over 6,500 child care providers. We're vaccinating child care professionals, and I proposed $370 million investment in the budget to make child care low or no cost for 150,000 Michigan families. And yesterday, my administration, the Early Childhood Investment Incorporation, and the W.K. Kellogg Foundation announced the establishment of a $6 million Child Care Innovation Fund to fund pioneering solutions for working families. These are positive steps, and they're a necessary part of the solution. Working parents also rely on schools to play a crucial role in making everything work as well. The transition to remote learning during this pandemic has exacerbated equity gaps statewide that we have been working to narrow. Students who are younger, economically disadvantaged, have special education needs, experience housing insecurity, or are learning English as a second language need in-person learning opportunities more than others. And while the response from countless school employees and community members to deliver nutritious meals to low-income students and deploy essential technology have been heroic, they are not sustainable in the long term. Our schools have the infrastructure to deliver those services and to remain the best place for our kids to learn and to grow. So it's clear that we need to return to in-person learning as soon as possible. But how do we do so? Is it safe to do so? Well, the short answer is that with proper precautions, resources, and guidelines, we can mitigate the risk and minimize community spread and return to in-person learning. Studies of schools that are open across the United States and around the world show that younger children are not a major source of transmission, either to their peers or to adults. And according to our research partners at MSU, the Education Policy and Innovation Collaborative, or EPIC, there is not a correlation between schools being open and community spread. In Michigan, we've seen few large outbreaks in pre-K-12 schools, and very little evidence of outbreaks due to in-person classroom learning. In the early days of COVID-19, we knew little about how this virus spread and little about the virus itself. Since then, we've learned a lot. We've paid close attention to evolving research and adjusted our guidance accordingly. For the better part of 9 months, medical experts and epidemiologists have closely followed the data and come up with a set of best practices that schools can follow to prevent infection and minimize the spread of COVID-19 and its variants. Some of the steps are steps that are very familiar to us by now, and we have explained to our own children countless times. Put on your mask, stay socially distanced, wash your hands, the things that we've been telling our kids for months. These simple precautions can protect all Michiganders and our kids as we go back to school, and our teachers and all the staff in our schools as well. We should follow this because containing this virus is good for all of us. So let's briefly dig into 3 pillars of public health. As we all know by now, universal masking is a must. Face masks must be worn indoors by all staff and students 5 and up, except for meals and other limited circumstances. Classrooms should be adjusted and arranged to space students out to follow social distancing protocols. In addition to separating desks, schools are encouraged to utilize all available space, including gyms, cafeterias, and multi-purpose rooms, to facilitate learning. Hand hygiene is the third key to the piece of this puzzle. The school should provide students and staff with soap, paper towels, tissues, signage to reinforce hand washing, and hand sanitizer that's at least 60% alcohol. There are also a few organizational strategies schools should implement to mitigate risk and minimize spread. Schools should designate a staff person to be the point person for responding to COVID-19 concerns. If feasible, schools should implement a cohort model, dividing teachers and students into distinct groups that stay together throughout the entire school day during in-person classroom instruction. Should maintain airflow. It's critical to keeping this virus at bay. Schools are encouraged to open windows, to use fans, change air filters more often, and upgrade heating and cooling systems. And schools must also secure their water supply. After a prolonged shutdown, steps must be taken to minimize the risk of lead or copper exposure or Legionnaires. Finally, to track infections and mitigate spread, schools must adhere to screening, testing, and quarantining criteria. Any staff or student that tests positive, exhibits symptoms, or in close contact with those who test positive should follow guidance set forth by MDHHS and their local health departments and quarantine and isolate for 10 days. Also, MDHHS recently rolled out a voluntary testing program where every educator in the state can receive a weekly rapid antigen test, even if they are asymptomatic. This will help us prevent outbreaks. For more information, check out www.michigan.gov/school COVID testing. All of the processes we have backed we have are backed by science and data and allow our kids to be back in class March 1. But to fully return to normalcy in all aspects of our lives, including school, we've got to get the Michigan COVID recovery plan passed so we can spend the federal dollars that have already been allocated to Michigan to ramp up our efforts to vaccinate our people and our educators and to provide more rapid tests for our schools. Currently, in accordance with the CDC guidance, MDHHS has classified teachers as frontline workers, making them eligible to receive the vaccine. According to a survey released by the Michigan Education Association, 2/3 of educators have already received one or both of their shots or made appointments to get their first one. This is a rate that is leagues ahead of the national one. That rate is currently around 18%. We're around 66%. Michigan's extraordinary educators are fiercely dedicated to their students, and our equitable vaccine rollout prioritizes them is going to go a long way toward helping get our kids and keep our kids back in school. As we need our educators, especially those who are fortunate enough to have received the vaccine, to get back into the classrooms too. To be clear, vaccinations for educators it's not a prerequisite to returning to in-person learning, but it is a priority of our administration. We know how to prevent the transmission of COVID-19 by following strict mitigation measures. We will continue getting shots in arms of teachers and support staff as quickly as possible, and we thank our local public health departments for prioritizing our educators. Schools are essential. I am proud that 97% of our districts are on track to meet our goal to provide an in-learning option for students by March 1. The vast majority of school districts have been providing in-person learning since the beginning of the school year, with an exception of our pause of high schools due to the second wave in December that was putting our hospitals at risk from being overcrowded. If we follow guidance on masking and hand washing, and we do our testing and tracing and facility upgrades and operational changes, I know we will be successful and ensure that our kids continue to learn and to grow. Michigan's extraordinary educators have adjusted alongside their students in incredible ways to keep our students engaged despite the distance. And I know countless other parents are so grateful for their work too. Teachers work hard during a regular school year, but over this last year, they've been heroic. And I want them to know that we are so grateful for everything they have done and the sacrifices they have made and all that they will continue to do on behalf of our kids. As we roll out this extensive guidance on schools and ramp up our vaccination efforts to help kids return to class by March 1, I, of course, like parents everywhere, are thinking about my own kids too. Every decision I've made to protect public health and save lives over the last year has impacted my kids as well. A once-in-a-century pandemic struck our state when my oldest was finishing high school. She was getting ready for prom and graduation and to spend a summer with friends before going off to college, and unfortunately, her own mother had to cancel the school year. Now she's finishing up her freshman year in college, but living at home doing it. And her freshman year looks unlike anything any of us imagined. And my daughter Sydney is finishing her last year of high school and is hoping by fall she can go and have that college experience. I want that not just for my kids, but for all of yours, for everyone in the state, to be able to get back to some normalcy. We are headed in the right direction. We've got to grit our teeth and keep doing the work. Every decision around schools feels personal because it is personal when we're talking about our kids. We all want what's best for them. By opening up some in-person instruction by March 1, we can ensure that our kids continue to chase their potential, getting our kids in class, protecting public health, and alleviating the burden on working families. So we need the legislature to pass the recovery plan so we can deploy the resources so we can be successful doing all of these things. No excuses, no games. Let's just get it done. We're expecting to make more announcements on additional re-engagements in the coming days. Our case numbers and public health metrics are trending in the right direction. And we're very pleased to see that and feeling very optimistic. So let's keep it up. And with that, I'd like to turn it over now to our Lieutenant Governor, the head of our Racial Disparities Task Force, to speak about our ongoing efforts to equitably vaccinate Michiganders. Thank you.
Thank you, Governor, and good afternoon. I appreciate being able to join the briefing today to give an update as to our state's response to COVID-19 and how we are addressing racial disparities and continuing to lead the way. I want to acknowledge in that effort, alongside the Governor, Dr. Jonae Caldoun. And I also want to thank Superintendent Carmody for joining us today to talk about what's happening in education and for our educators. As the Governor noted, she's a parent. I'm the parent of twin second graders who have also been navigating remote learning in their own way, and a baby girl as well. This is important to every parent and every family across the state of Michigan. When I last participated in one of these press briefings, it was in December to announce the creation of the Protect Michigan Commission. And I'm proud to serve as one of the chairs of that commission alongside Dr. Caldoun. The purpose of this commission, which is the largest and most diverse commission that our administration has created to date, is to make sure that every Michigander from every corner of the state, in every community, and every walk of life, has the information and resources they need to choose to get vaccinated when it is their turn. I have conversations every day with family, with friends, with neighbors about the vaccine, about its safety, and about its effectiveness. People have questions, and that is okay. Those questions have answers. And this commission exists really to make sure that we are doing everything we can to present people with information that's credible, that's factual, and that will help them by having it come from resources who they trust. We have plans as a state to invest in ensuring that we address and eliminate disparities in vaccine uptake, building upon the work of the Racial Disparities Task Force, which we've been leading for the past 11 months. As I promised and committed to at the start of this pandemic and this public health crisis, our work to flatten racial disparities in health and other outcomes can and will continue beyond COVID. The Racial Disparities Task Force will continue to work on addressing these disparities while being transparent about our processes and our practices. And I'll continue to have an honest dialogue with all of you about where things stand, including issues that previous administrations have failed to or did not want to address head on. With that being said, I do want to talk about vaccines. And I want to reaffirm the commitment that Governor Whitmer and I made, that we want to make sure that every vaccine dose is distributed equitably. As we've said previously, everyone who wants a COVID-19 vaccine will be able to get one when the time comes, and that includes me. I am relatively young, relatively healthy, black man who will get vaccinated publicly when it is my turn. We also must take great care to ensure that the process is done in an equitable way, and we must make sure that we're being responsive to the specific questions and challenges that different members of different communities have about vaccination. Yesterday, the Michigan Department of Health and Human Services released data that's now available that we can share about race when it comes to vaccinations. We did not wait for the data to be perfect because we're committed to showing our work. This data is available on the COVID-19 vaccine dashboard at michigan.gov/COVID vaccine, and it will help us track the progress that we are making as a state as more people choose and get vaccinated to ensure that this safe, effective COVID-19 vaccine protects the most vulnerable Michiganders. Black and brown communities in our state have been disproportionately affected by the virus, and improving the race and ethnicity data being collected for vaccinations is critical to ensuring the vaccine's equitable distribution. Upon seeing the initial data that was reported, it's clear we need to continue our efforts to get more communities of color vaccinated and close the gap in the data that is being reported. The old tracking system that we had in Michigan was unable to track almost 45% of demographic data on vaccinations today. Let me put that into more perspective, because the governor talked about us having more than 1.9 million vaccine doses distributed. That means that we do not know the race of almost 1 million of the nearly 2 million people who have gotten at least one dose of a vaccine. But we have to address that data problem so that we can understand the shape of this problem. That is why our teams created a new direct data entry tool that is now live and allows providers to improve the submission rate of race data for all vaccines administered by entering it directly into our state system. We are encouraging all of our distribution partners to do this right now. We also encourage every Michigander to fill out the race section of the forms that they complete when they're signing up. This will also help us close the data gap. Now look, I'm an engineer, and I've dealt with numbers a great deal in my career. This data is a starting point. However, I do caution against drawing premature conclusions while we don't yet have the full picture. And as a former software developer, I know that you can't just flip a switch to make a system happen. But that is why it's taken time to get it right, but we will get this right. We have shown national leadership in this area before as a state. We are one of the first states in the country that instrumented our public health system to be able to track data on race and ethnicity when it came to COVID-19 test results and COVID-19 deaths. We used this data to take aggressive action and ultimately led the nation in making progress toward flattening racial disparities. I know that we can do this again on vaccines because we've done it before in this pandemic. Now, combating COVID-19 is deeply personal to me, as it is to so many people in our state. As I've shared, I've said goodbye to 27 people from this virus. Now is the time for us to come together to encourage everyone to take part in this safe and effective vaccine. I want every person in the state to get their questions answered and concerns addressed so they can get vaccinated. This especially includes communities of color, where people have been not only devastated by the virus and its economic impact, but also historically may not have trusted vaccination processes. It was in this spirit that I worked with and took my 83-year-old grandma to get her vaccine dose right there. I was able to accompany her to a vaccine site in Southfield recently to get her first dose. And it's never been more obvious to me that someone was smiling under a mask than it is in that photograph. I want to sincerely thank all of the professionals and volunteers who I met and I saw in Southfield that day at the pavilion, and thank the folks in Oakland County as well for their life-saving service to the community at that site. And I was also really proud to see that day at the Southfield Pavilion that the overwhelming majority of people who were lining up to get their vaccine dose were Black Michiganders. I want to assure everyone, we have a plan to vaccinate the people of our state equitably, and we will keep working that plan to meet our goal. And from here on out, the demographic data will be available to help guide our ongoing strategic response, and it will be available to the public. Let me say it again. We are getting shots in arms and will continue to do so. We will use the data to continue to drive our strategy to ensure equitable access. Governor Whitmer and I are also working quickly and working every day to make sure that we can get more vaccines, especially to the people who need it most. By revamping and including this data in the system that providers report into, we're able to continue to address racial disparities and move closer to our goal of vaccinating at least 70% of Michiganders who are 16 and older as soon as possible. The state of Michigan is currently using the CDC's Social Vulnerability Index to ensure vaccines are distributed equitably. What that means is this index takes into consideration things like race, ethnicity, disability status, access to education, and other factors. As we continue to expand our state's vaccine program, we must build upon the work that we have done in this space to ensure equitable access to the vaccine. We are already making significant progress. Since December, we have tripled the percentage of vaccine doses that have been distributed to Black residents. We will honor the legacy of those who we've lost to this virus by ensuring that we all get a vaccine from this virus when it's our turn. As Governor Whitmer said, we're going to continue working to meet our vaccine goals so we can protect public health, so we can put people back to work and jumpstart our economy, and so that we can send our kids and educators back to in-person school safely and soon. To everyone watching, I want you to keep standing tall for Michigan, and together we will overcome COVID-19. Overcoming is what we do as Michiganders. We see obstacles and we overcome them. We see challenges, we overcome them. We invent, we innovate, and we overcome. It's now my honor to turn the podium over to our Chief Medical Executive, Dr. Jonay Calhoun.
Good afternoon, and thank you, Governor and Lieutenant Governor. So we continue, as the Governor said, to see positive trends in the key metrics that we are tracking for COVID-19. We are now at 95 cases per million, and that case rate has been declining for 6 weeks. Our percent of tests that are coming back positive continues to trend down as well, and is now at 3.5%. 4.9% of available inpatient beds are being used to take care of patients with COVID-19. That's also trending in the right direction. Now, while we are pleased with these metrics, I am concerned that our testing numbers are declining across the state. The weekly average for tests across the state last week was about 35,500 tests per day. Now, in November, we saw several days that were above 60,000 tests per day. Testing is still a critical part of our COVID-19 response. We want everyone who needs or wants a test to be able to get one. Testing is the only way we are going to be able to track the spread of the virus and to slow its spread. And testing is an important tool, as has been already mentioned, for us to be able to reopen critical parts of our society, including getting and keeping our kids in school. So anyone who is experiencing symptoms, anyone who's been exposed to someone who has COVID-19, and anyone who has traveled outside of the state of Michigan in the past 14 days should get a test. And you can go to our website, michigan.gov/coronavirus test, to find a location nearest you. Tests are also the way that we are going to be able to identify the new variants of the virus. To date, we have identified 314 cases of the more easily transmitted B.1.1.7 variant here in the state across 19 counties. And there are possibly more that we have not yet identified. Models and national experts predict that this new variant could be the dominant one in the United States by the end of March. And this means that for every case of COVID-19, it is more likely that that person will infect others if they have this new variant. But the good news is, the same basic public health measures that we've been talking about, mask, social distancing, washing hands, and getting a vaccine when it is your turn, those things slow the spread of the new variants as well. So it's important that we all continue to be vigilant. We've also seen progress on our vaccination efforts, as has already been mentioned. More than 1.9 million doses of the safe, effective vaccines have now been administered in the state. About 15.5% of Michiganders over the age of 16 have received at least one dose. That means that almost 675,000 people are actually fully vaccinated with 2 doses of these safe and effective vaccines. And about 41% of people over the age of 75 in the state have had at least 1 dose of the vaccine. This is great progress towards our goal of vaccinating at least 70% of Michiganders aged 16 and up as quickly as possible. We're also actively working to make sure there's equitable access to vaccines. Yesterday, as Lieutenant Governor mentioned, we released our vaccination data on race. Similar to what we're seeing across the country, white Michiganders have the highest vaccination rates, followed by American Indian or Alaskan Natives, Asians, Native Hawaiian or Pacific Islanders, and then Black or African American residents. Unfortunately, we're also missing a lot of our race and ethnicity data for those who are getting a vaccine. I want to ask everyone that if you do get your vaccine, please share your race and ethnic data information with your provider. This will help us understand how well we're doing with our vaccination efforts and will help us get more vaccines out to those who are the most vulnerable. We know that everyone should be able to access these safe and effective vaccines regardless of their race or ethnicity, their income, if they have access to transportation, or if they live in a rural or an urban part of the state. And we will continue to advance our equity strategy and will be encouraging vaccination efforts that focus on removing barriers to access, bringing vaccines into neighborhoods where people live, and targeting our most vulnerable. Any of the over 2,400 federally enrolled COVID vaccine providers can now apply for up to 2,500 doses of vaccine as part of the state's special effort to vaccinate vulnerable populations age 60 and up. Applicants are encouraged to highlight strong partnerships with community-based organizations and an ability to effectively reach the most vulnerable residents in their communities. More information about this project is available at our website, www.michigan.gov/coronavirus. And again, for everyone who has not yet received a vaccine, either because an appointment hasn't been available for you or you are not yet eligible, thank you for your patience. We will continue to work with our federal and local partners to expand access to vaccines. Everyone who wants a vaccine will be able to get one. We also know that our older Michiganders are some of the most vulnerable to COVID-19. And I'm proud of the work of Dr. Alexis Travis and her leadership of the MDHHS Aging and Adult Services Agency. They have worked hard throughout the pandemic to support our aging population with resources and information to protect them during this pandemic. One of those resources is called CV-19 Checkup. This free, anonymous, and personalized online tool evaluates your COVID-19 risk. The questions on this website take about 5 to 10 minutes, and afterwards you will receive a report that answers questions like whether or not you are at severe risk of COVID-19, where you can access resources to meet basic needs during the pandemic, and more. CV-19 Checkup is available to all residents, but designed with older adults in mind. To check your risk, visit michigan.cv19checkup.org. So while we are doing well, our progress is fragile. We have to make sure we are doing enough tests so we can quickly identify any new cases, including cases infected by these new variants. Everyone has to make sure they wear their mask properly anytime they'll be around someone outside of their household, avoid large gatherings, and get their vaccine when they are eligible. If we all remain steady and focused, we will be able to end this pandemic as quickly as possible and get back to a sense of normalcy. And with that, I will turn it over to Superintendent Carmody.
Good afternoon. Thank you, Governor Whitmer, for your leadership on this critically important issue in support of the 1.5 million students in the state of Michigan. Late this summer, the Back to School Roadmap provided school districts the blueprint that allowed many schools to safely return to in-person learning, including Meridian Public Schools, where almost 90% of the students that I serve are learning in person every day. My community was devastated by a 500-year flood last May that damaged or destroyed hundreds of homes and businesses. So my community suffered from this event, coupled with the impact of COVID, which made returning to in-person learning even more important for my students and staff. Fortunately, by following the recommended protocols in the Back to School Roadmap, such as wearing a mask, cohorting of students, enhanced cleaning, hand washing, and frequent refresh of outside air, we were able to safely return to school this fall. We have not had any in-school transmission of COVID-19 during this school year. Consistently throughout the school year, our schools have been safe for our students and staff. We have received significant support from our local health department officials who have provided guidance, updates, assisted with contact tracing, and most recently, provided us with 2 vaccine clinics in support of my students and staff. I appreciate Governor Whitmer for her leadership in prioritizing the vaccine so that we can continue to support and serve our students. Recently, schools have also had additional resources from the state, such as rapid antigen tests for staff and athletes, that have allowed additional activities to safely resume. I'm thankful for the continued decline in our state and local COVID numbers. And, like all of you, look forward to a time when we can put this virus behind us. Schools and educators have never been more needed. Earlier this month, I was appointed to the Governor's Student Recovery Advisory Council that will work to support and ensure that our students and educators are provided with the tools and plans that they deserve. This council will focus our efforts in support of all students and look to address the inequities that exist, provide recommendations to support academic and trauma recovery, and ensure that our 1.5 million students can safely return to the classroom. We have amazing students that we serve and need for us to tackle these important challenges. Lastly, I'd like to say thank you to my amazing students and staff at Meridian. It's an honor and a privilege to serve you. Thank you to all the educators in this state that are working hard every day to make a difference in the lives of our children.
Thank you, Mr. Superintendent. I will tell you that over the course of the last 12 months, there have been a lot of challenging moments. The night of the breach of the 2 dams in your area was one of the low points, but the next day when I came to Midland and I saw what was happening in your school and saw the community come together, it was one of the most inspirational days of the last 12 months. So thank you for your leadership and for being here today. With that, I am happy to open it up for a few questions. I know it's been a little bit longer of a press conference than we usually do, but we had a lot to cover, so happy to answer a few questions.
Thanks. Just a reminder to media to use the raise your hand feature if you have a question. We'll turn it over to Kobe Levin at Chalkbeat.
Hi, Governor. A question on school reopening. There are still a handful of school districts, including some larger school districts, that haven't announced a plan for reopening. What would you say to leaders of those districts, and what can your administration do to ensure that all schools are in person by at least for students who want it by March 1st?
Yeah, appreciate the question. And, you know, as we have said many times from this podium, you know, with so many school districts in Michigan, we thought it was really important that we put together a roadmap so that they know what to do in order to be safe, that we acknowledge that we've got lots of different assets and hurdles in different districts across the state, and so we wanted the decision to be at the local level. But we want to empower districts to get back into the classroom. I saw, just as I was coming up here to speak, that Ann Arbor made an announcement. Pleased to see that we are over 90% of our schools have some sort of an announcement or already in person, and that I think is very positive. The majority of the remaining 3% have put down tentative start dates, and so as long as we follow the guidelines of the CDC and get the legislature to get the resources, $1.7 billion that is supposed to be going directly to our schools, and vaccination efforts, and the money we need to buy those antigen tests that we have been deploying to schools across the state, these are all aspects to being successful here. So I know that there's been a lot of people saying that they want, that this is the goal. But in order to reach this goal and to be successful doing it, we've got to get that COVID recovery plan done. And I think you've heard lots of reasons today why it's so important that we do and why we get back in person.
I'll turn it over to Eric Lloyd, 910 News.
Hello, Governor. Up until your press conference last week, I know that a vast majority of people were under this understanding that the epidemic order was going to end on the 21st, and then it was discovered that it was actually extended, that a lot of people didn't know. Was that done on purpose to keep that more quiet? And then do you understand how some people have issues with transparency with that?
So I was a little surprised by the reaction, to tell you the truth. Anyone who's just even casually watched over the last 12 months knows we have a tendency to have about a 3-week cadence. We make a change, see how it's going, watch the data, report on the data, make changes along the way, but usually 3 weeks or longer increments, and that's no different in this case. So frankly, I was a little bit surprised by the kind of characterization of it. We've been very open. We've been sharing data every step of the way. There are a lot of reasons to feel very positive right now. The variant is not a good reason to feel positive, with it being the second most variants in the country right now in terms of the B117, in terms of the sheer number of cases. But, we still are seeing low positivity numbers and high vaccination rates, and so it's generally headed in the right direction. And if you think about that timeline, it would probably, you would conclude justifiably that in the coming days we will be assessing and making more determinations on a number of fronts.
Thank you, Governor. We'll turn it over to Dave Boucher with the Detroit Free Press.
Hi, Governor. Thank you for your time. Earlier in this press conference, you mentioned the ability of loved ones to visit their family members in nursing homes. Do you have any update on when or if nursing home visitation regulations might be eased or rescinded, or whether you're looking at doing that?
Yeah, so, my administration, MDHHS, we've been, the North Star has always been the science and the data. We're looking very closely at the trend lines, as Dr. J mentioned a little bit ago. We have seen really Michigan move into a much stronger position. We're very concerned, and we've taken action and followed the data, and we're hopeful that we'll be able to announce additional aspects of re-engagement on that particular front, hopefully as soon as next week. So to stay on this path, though, we've got to do two things, right? We've got to each do our part, masking up, washing our hands, staying socially distant. We need the legislature to do their part, which means deploying the federal dollars that the Trump administration sent to Michigan to help their constituents and all of our citizens. These dollars are crucial for success on all these fronts: getting kids back in school, opening up additional ability to visit a loved one in a nursing home. Antigen tests are crucial, and we are running out. There's a 2-week lead time, and we will be out in the coming weeks if we don't get more resources. So whether it's the $1.7 billion that goes directly to schools, or it is the $800 million roughly that is going into our vaccine strategy, or it is the resources necessary for testing, these are all important components to re-engagement in a way that is sustainable and successful and ultimately strengthens our economy.
Next question will come from Craig Mauger at the Detroit News.
Thanks, Governor, for taking my question. I'm curious, how close do you think the state is to lifting the limitation on household gatherings, given the fact that so many people have been vaccinated at this moment?
I think that's a good question, and like whether it's a nursing home visitation or anything else, as we are determining next steps, this is a part of the conversation that we're having. We're watching the data. One of the things, though, I caution is that we know the biggest places of spread this fall were in homes, right? They were gatherings that were happening where people were dropping the guard, and we know that it happens. So we're going to take if we're taking a step, they will be incremental, as has been all of our re-engagement, so that we don't, contribute to a big spread possibly. And that's why every step we've taken has been incremental. Like we've said, it's a dial, not a light switch. I know you heard me say that many times, but that really is the case. And that the gatherings order is one component of the possible areas that we may make some changes in the coming days.
We have time for just a couple more questions. We'll hand it over to Taylor with MLive.
Good afternoon, Governor. I wanted to ask, you mentioned there might be some re-engagements coming in the next few days. I wanted to ask about restaurants specifically. What have you heard from restaurant owners in terms of the 25% capacity limit and the 10 p.m. curfew? And are those things that maybe we could see changed in the next couple days, or might not it be until March 29th?
Well, I've heard the same things you've heard, right? They want to go to 50%, and they think that it can be done safely. And I get that. Like, that's what I expect to hear, and I am hopeful that eventually we get to that point. But at this juncture, we've been at it just a couple of weeks. We've got to keep watching the data. We got to make sure that we've got antigen tests that are available. I just quickly, to Dave's question, we need 3 to 4 million antigen tests per month for nursing homes and schools alone. And that's why those relief dollars are so important. We've got to be able to buy those. So my hope is, if the legislature can get moving on deploying these federal dollars that, like I said, the Trump administration sent to Michigan, I can't understand why the legislature would not deploy $5 billion into the Michigan economy for vaccines, for testing, for resumption of in-person learning, for small business relief. I mean, $5 billion was sent to the state of Michigan and signed by Donald Trump to help the people of our state. And many other states have moved forward and gotten those dollars deployed, and Michigan still hasn't. And it threatens to undermine our economy, our ability to keep people safe, our efforts around keeping our numbers low and our vaccinations high. And every one of us wants to get back to some normalcy, and these resources are a critical component to it.
And final question, we'll go to Rick Albin with Wood TV.
Governor, thank you for taking the question. I think I know the answer, but I've had actually some viewers that have asked me about this. Even though about 97% of the schools will offer an in-person option starting next week, and we heard in Meridian about 90% of the students are already taking that, are all school districts still required to maintain a virtual component through the end of this school year?
I think most school districts are. Are they required to? I mean, we haven't mandated that, but the practical reality is if they're not fully back in person, that's what they will continue to do. So I'm not quite sure if I've really answered your question, Rick, but that's kind of where things are. I know in my daughter's school, for instance, that